Distinguished ladies and gentlemen, shall we rise? Distinguished ladies and gentlemen, please, shall we remain standing as we welcome in our midst? We await the official arrival of the special guest of honor. While we remain standing, shall we take the national anthem to be led by the police band? Thank you very much. You may please be seated. Distinguished ladies and gentlemen, may I crave your indulgence in reverence to our dear nation, and of course, with the prevailing situation, rise for the national prayer, which would serve as our opening prayer. The second stanza of the national anthem will be recited in unison. If you're not quite familiar with that, please open to the second page of the program of events as we take the national prayer, which is the second stanza of the national anthem, on the count of 2. Shall we rise, please, for that? On the count of 2, the national prayer. 1, 2. O God of creation, direct our noble cause. Guide our leaders right. Help our youth the truth to know. In love and honesty to grow. And living just and true. Great lofty heights attain to build a nation where peace and justice reign. Amen. You may please be seated. Please just write and pass. Just write and pass. The chairman of this occasion, the co-chairman, special guest of honor, our special guests, the guest lecturer, President, Nigerian Medical Association and the Nigerian Dental Association, the Registrar and Chief Executive Officer of the Medical and Dental Council of Nigeria, management and staff of the MDCN, parents, well-wishers, and other guests here present, with a special recognition to the wife of the Katsina State Governor, distinguished inductees of today, who any moment from now will earn the right to legitimately use the doctor title before their respective names. Gentlemen of the press, ladies and gentlemen, it's my honor and privilege to welcome you to the swearing-in, call it the induction ceremony of 211 foreign-trained medical and dental graduates from across the world who from today will be licensed to practice medicine, surgery, and dentistry in Nigeria. For that, I think you deserve for yourselves a warm round of applause. Your Excellency, distinguished ladies and gentlemen, please permit me to welcome to this occasion our chairman of today, the one popularly known among peers and colleagues as the village doctor, a retired professor of surgery, a consummate medical doctor, and past chairman of the Medical and Dental Council of Nigeria. The Code of Medical Ethics, which is a vital document of reference throughout the practice of medicine and dentistry in Nigeria, will be handed to every inductee of today. The last version of this document, which you will be collecting, was finalized under his leadership. Distinguished ladies and gentlemen, with his wife, please welcome Professor Shima Gil, OFR. And seated right beside him is, of course, his wife of enviable virtue. You're welcome, ma. Please put your hands together for her. The co-chairman of this occasion is a man I have utmost regard for. He is the Emeritus Chairman, Governing Council of the Medical and Dental Council of Nigeria, a seasoned professor, a seasoned professional, a professor of surgery, an officer of the Order of the Niger, a fellow of the West African College of Surgeons, fellow of the Royal College of Surgeons in Glasgow and London, a man who exemplified himself in the delicate practice of cardiothoracic surgery and intensive care at home and abroad. He's excelled in the medical administration and academics, having served as one-time Chief Medical Director and another time the Deputy Vice Chancellor Academics for the University of Maiduguri. Distinguished ladies and gentlemen, the co-chairman of this occasion, Professor Abba Waziri Hassan, OON. Distinguished ladies and gentlemen, please welcome with me the Registrar and Chief Executive Officer of the Medical and Dental Council of Nigeria, the man who sees to the day-to-day running of this council and every success, and of course, the responsibilities rests on his shoulders. Distinguished ladies and gentlemen, he was named TAPS. You may be wondering why. Maybe Providence has it that he would one day run the affairs of medical and dental practice in Nigeria. Dr. Tajuddin Adisa Bola Sanusi. Distinguished ladies and gentlemen, if you've been following the news, You will hear about the typical about university certificates, transcripts, and all of that. For me, if I ever find myself in that situation, all I need is a single expert witness, in person of the man who admitted me to study medicine and surgery as the Provost College of Medicine, and later signed me out as a graduate of medicine and surgery in his capacity as the Vice Chancellor. He needs no introduction, having served the country as a reputable Honorable Minister of Health. This man would later become the Honorable Minister of Health of the Federal Republic of Nigeria. Ladies and gentlemen, the guest lecturer for today is a seasoned administrator, an astute politician, an accomplished academician who has trained teachers of teachers, a diligent clinician, being an accomplished obstetrician and gynecologist of international repute. Distinguished ladies and gentlemen, Professor Isaac Folorunsho Adewale. Please, to join the high table are the people who lead the association that these distinguished inductees would be joining any moment from now. The Nigerian Medical Association and the Nigerian Dental Association. Distinguished ladies and gentlemen, the president of the Nigerian Medical Association is here in spirit, but physically he's represented by the chairman of the Nigerian Medical Association of the Federal Capital Territory, my boss, Dr. Charles Ugwuanyi. Please welcome to the high table, sir. And of course, joining him is his brother, the president of the Nigerian Dental Association, Dr. Tope Adeyemi. May I, at this juncture, recognize the presence of dignitaries in our midst. Let me start by recognizing, of course, the Royal Father here present, His Highness, Alhaji Dr. Muhammad S. Haliru Dantoro, CFR, the Kitoro IV Meibogu, Emir of Bogu Kingdom in Niger State. Distinguished ladies and gentlemen, shall we please welcome and rise for the special guests of today, the Honorable Minister of State for Health and Social Welfare in Nigeria, Dr. Tunji Alausa. Please be seated. Check, 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 check. Permit me to present to some and introduce to others a man who has been mistaken to own all the buildings in a certain prestigious area of Ikeja in Lagos State. Maybe today he will clarify to us if indeed he is the landlord of all these buildings. Distinguished ladies and gentlemen, a seasoned nephrologist, a graduate of medicine and surgery from the prestigious University of Lagos. I'll refrain from either identifying that as the campus of the University of Ibadan. That is not why we're here today. He completed his residency program in the Cook County Hospital in Chicago, so he qualifies as foreign trained like many of you. He also served in the academia as an assistant professor at Rush University Medical School. While in the United States, he was at the forefront of value-based care, an initiative for restructuring healthcare systems to provide value for patients. Little wonder, His Excellency President Bola Ahmed Tinubu brought him back home to serve as the Minister of State for Health and Social Welfare in Nigeria. Welcome with me once again, Dr. Tunji Alausa. Also here with us as the proud parent and well-wisher of the inductees is the First Lady of Katsina State, Hajia Fatima Dikko Rada. Upon the completion of your mandatory housemanship, you would be enrolled to the compulsory National Youth Service Corps program, the NYSC. The current Director General is here, and little wonder, we have military presence among us. Distinguished ladies and gentlemen, the Director General of the National Youth Service Corps, Brigadier General Y.D. Ahmed, is here with his wife, Hajia Asmau Ahmed. I'm interested to join others to understand why, at a certain rank, military officers rarely look like they are military officers. Am I alone in this thought? You're welcome once again, sir. At this point, distinguished ladies and gentlemen, we will have a solemn moment. As a few days ago, the announcement was made of the passing of an ancestor of medical practice in Nigeria. Until his death, he was the chairman, board of trustees of the Nigerian Medical Association. He served the country in numerous capacities, too numerous to mention, as vice chancellor at some point, as the country representative of the World Health Organization. He served the northern region in so many places. And of course, he was among the first set of medical graduates from the first university in Nigeria, the University of Ibadan. Distinguished ladies and gentlemen, I'm talking about no other than our dear father, great-grand teacher of teachers, Emeritus Professor Umar Shehu, CFR. Shall we please rise for a moment of silence in honor of this our departed father? May his soul rest in perfect peace. You may please be seated. And with that, distinguished ladies and gentlemen, we begin the program with an opening remark first by the chairman of this occasion, Professor Shima Gil, OFR. The opening remarks, sir. Can we take the delegate mic to... Sir, would you mind... I thought Prof deserves a round of applause as he walks from his seat down to the microphone, as is customary of him. He would always request to walk all the way by himself. You're welcome, sir.
Honorable Minister of Health, my distinguished colleagues on the high table, former ministers, it is a great matter to us today to come to induct doctors, to lead them to join the health services of Nigeria. I can assure you that this is a very wonderful time for me and for Nigeria, because there has been and there continues to be an exodus of medical personnel carefully trained in Nigeria who go overseas. It is very nice to get our doctors who trained overseas to come for induction. All I am saying to you, the new doctors, is that today you are going to make a commitment to Nigerians that you are going to serve Nigeria. I don't want anybody to turn around and go back overseas. It is true that matters are difficult in our country today, but we're not waiting for somebody else to come and make them better. If you have a problem thinking that people are not trying, Dr. Ogwanye is here with us, working, doing very vital work in the private sector for the help of Nigerians. I want all of you to promise me that you are going to stay. If anybody is going to stay, let them stand up. If you joke, we will send the police to lead you out. So, whatever conditions that you find in Nigeria, you are very intelligent, you would be able to somehow manipulate, gain, and find ways of saving Nigeria. We need you very much, and I hope that all of you, well, today is a very happy day for you and very happy for us, very happy for me, and I hope that no one is going to make it very sad. So thank you very much, and we'll get on with the program.
I thought the chairman deserves a louder round of applause. Let me remind you once again, at the end of today, you will be given a copy of the Code of Medical Ethics. Please endeavor to read within the merriment. I hope you do not one day remember and ask yourself why you didn't read that book. The Medical and Dental Council of Nigeria has a disciplinary organ that do not hesitate to wield the big stick if need be. Distinguished ladies and gentlemen, the co-chairman of this occasion is here to give his opening remarks as well. Please welcome to the microphone, Professor Abba Waziri Hassan OON.
Before I speak, I want to just correct the impression. You can't be a co-chair with your teacher. So probably it's right to call me somebody holding a book for the chairman. For everybody's information, Professor S.K. Gio left us in the 5th year of medical school in 1975 to become a commissioner for information in Benue, for that matter. From being an astute thyroid surgeon who taught us what we thought doing surgeries on thyroid is simple until I went to do residency. I found how it is. So he has already said everything that needs to be said. And I think I just need to address our special guest, the Honorable Minister of State, my boss, the former Minister of Health, through whom the President appointed me to chair this MDCN about 5 years ago. Distinguished ladies and gentlemen, the registrar, management of MDCN, I just need to congratulate you, and especially the graduates having gone through this tremendous occasion. And you have had the advice from the elder about staying to serve the country. I wish you and you and your parents congratulate you again for having come into this profession, and I hope all of you will try to abide with what you are going to take from this occasion. Thank you very much.
Thank you very much for the brief remark. Distinguished ladies and gentlemen, among the very highly distinguished guests here present is an accomplished medical professional, obstetrician and gynecologist. She's been in the public and the private sector. She's been in the clinical setting. She's been in the academia. Distinguished ladies and gentlemen, please welcome Dr. Mrs. Nilola Mabogunje. And it's my honor and privilege to whisper to this auditorium and say happy birthday to you, ma. Please, another round of applause for her. Let's clear the aisle so the cake can come in and then we can all cut and enjoy ourselves. Distinguished ladies and gentlemen, it's a day of merriment. It's a day worthy of celebration. It's a feat to have trained outside the country and be assessed by distinguished professionals across the country and be found worthy of practicing in Nigeria. As they say, many are called, few are chosen. I congratulate you for being among the successful ones. Please, feel free to appreciate yourselves. Among the proud parents and well-wishers here with us is a member of the National Assembly representing the good people, I don't know who represents the bad ones, of Chibok, Damboa, Goza constituency. He currently serves as the chairman, Insurance and Actuarial Matters of the National Assembly in Abuja. Honorable Ahmed Jaha. Also with us is a senior advocate of Nigeria, Mohammed Ndarani Mohammed. Permit me to, at this juncture, appreciate the team who work assiduously to ensure that the affairs of this council is run smoothly, supporting the registrar in these operations. First is to recognize the Deputy Registrar and Head of the Department of Medical Education, here present Dr. Nemeka Wakama. The Head of Department of Registration, you're all familiar with him, Dr. Henry Okwokenye. The Head of Department of Professional Discipline, I hope you only get to wave at him when you pass. Dr. Enejo Abdul is here. Also here with us is Dr. Tijani Ali Mandara, the Head of Inspectorate Division. The head of administration is here with us, Alhaji Abdul Ghani Oladokun. I thought I saw Hajia here. Hajia Sakinat Mustafa, the head of Department of Finance and Accounts. Okay, she's on leave. Beg your pardon. I will definitely introduce others as soon as I have the names with me. But let's proceed with the program of today. And the next item is the keynote address by the special guest, the Honorable Minister of State for Health and Social Welfare in Nigeria. Ladies and gentlemen, Dr. Tunji Alausa, to the microphone, please.
Thank you, and good morning, everybody. Let me start by apologizing on behalf of the Coordinating Minister of State, Professor Mohammed Ali Pate. I loved to be here with us today, but due to some other pressing national assignments, he was not able to join us. But he sends his wishes to everybody. I'd like to recognize Professor Shima Goy, one of the chairmen of today's occasion, Professor Abba Hassan, our co-chairman, Professor R.F. Adewale, our guest lecturer for today. I'm sure everybody's waiting for the wisdom we're all going to get from his lecture. Also, the Registrar of Medical and Dental Council of Nigeria, Dr. Tajuddin Sanusi, President of the Nigeria Medical Association and the Nigeria Dental Association, members of the National Assembly present today, our Royal Father, Emir of Bogu, Director General, Nigerian Youth Service Corps, other distinguished ladies and gentlemen present, and able and well-represented gentlemen and ladies of the press. Good morning again, everybody. It gives me a great pleasure to be present at this year's induction and swearing ceremony of a foreign-trained medical and dental graduates. Permit me to congratulate you and your parents on your success in the outcome of your examination conducted by at the University College Hospital Ibadan in July of this year. This is a significant event and very strategic in a renewed drive to move our health sector forward and change the negative narratives of Nigerian poor health indicators. I don't need to stretch further the obvious human resource crisis that is global, but was still driven by impact of COVID-19 pandemic and the push and pull factors that encourage our young doctors and specialists alike and other health professionals to seek for supposedly better opportunity abroad, which has now become the common lexicon, the so-called lexicon called JAPA syndrome, which hopefully this government will do everything to reverse. Training of foreign doctors comes with its own peculiarities, considering the high cost and the terrain where they are trained. You will all agree with me that a lot was committed to your training. May I encourage you and remind you today, you're being inducted to a very noble and prestigious profession. And this profession is guided by strict ethics that always prioritize your health and the health and well-being of your patients. At this point, let me give you a new inductees and the media present today a little insight into the focus and direction of the reinvigorated approach the Ministry of Health, under this administration, will take. The mass exodus of licensed medical doctors and other health professionals to more developed countries that has brought significant disruption to Nigeria's healthcare system will be discouraged by making our healthcare environment more attractive through strategic investments in infrastructures and prioritizing the welfare of our health professionals. We have just recently put plans and strategies in place to double the productions of doctors and dentists from the current number of about 5,000 to 10,000 from the next academic year. Beyond doubling the capacity of a medical school, this increase from 5,000 to 10,000 will have a direct impact on our tertiary education, and more importantly, help to fulfill the aspiration of teeming youth who want to study medicine and dentistry, but limited opportunity due to low capacity for clinical training, which has inhibited their dreams of getting admitted to medical school. So by the next academic year, we will double the number of medical and dental students being enrolled. We're also working to do the same for other health professionals, like other health professions like pharmacy, nursing, physical therapy, community health extension workers, radiographers, and other allied health professionals. This will be done in phases, but in a very timely manner to arrest the shortage of human resource for health that we're currently experiencing in our country. On funding, we shall continue to advocate for more funding into the health sector. The coordinating minister and I have both identified this key gap while we work towards domestic and other forms of resource mobilization. Again, we intend to increase our value chain that puts us in a position to attract more international grants and funding, and also to better coordinate the current level of developmental partner grants that we currently have. We're determined to promote industrial harmony in the health sector by discouraging industrial actions in the health sector that has bedeviled the system for a long time. The primary healthcare system in Nigeria will better be positioned to address the several challenges that has impeded accessibility, quality, and effectiveness of our healthcare delivery system. Attaining universal health coverage is a must for for our nation. As everybody has followed the President Bola Ahmed Tinubu, during the campaign period, he consistently emphasized universal health coverage as a pivot of one of the social priorities for our country. We shall ensure all individuals and communities have access to essential health services without suffering financial hardship by optimizing the health insurance system, promoting equitable access, and investing in our health infrastructure. As we celebrate the achievement of our children today, I would like to advise our parents to look for advice from the Medical and Dental Council of Nigeria on the countries to send your children to. Over the past years, poor performances in board exams for foreign-trained medical personnel is traceable to inadequate training that falls short of a required standard in Nigeria. We cannot compromise standard that will lead to reckless loss of life, especially mothers and children. The standard of this exam for foreign-trained doctors and dentists will at no time in the life of our country be downgraded. We will maintain a current high standard. So, I strongly advise that we interrogate the standard of education that is being offered to our students when they get sent to foreign countries. The new inductees. Your next phase is to become engaged as house officers. You may note that your service as the first on call requires that you take your responsibilities with utmost dedication and maintain the integrity of this noble profession and not endanger your own lives or the lives of the patient you'll be privileged to care for. As you are inducted today, may I advise you to take the posting given to you by the Nigerian Medical and Dental Council as house officer. This will ensure not only the widespread of doctors to suburban areas, but also unnecessary delay in completion of your training. Finally, let me congratulate you once again and wish you a very, very successful career in this noble and prestigious profession. Thank you for listening.
Thank you very much. Check. That was more of an admonition from a senior colleague, Dr. Tunji Alausa, Honorable Minister of State for Health and Social Welfare in Nigeria. Another round of applause for him, please. Distinguished ladies and gentlemen, I'm happy to inform you all that this event is being streamed live via the MDCN social platforms, at MDCN Official on Twitter, at Official MDCN on Instagram, and on Facebook, Medical and Dental Council of Nigeria. Please tell your friends and well-wishers to join us and watch the proceedings live. A quick update to the recognition of dignitaries here present. From the Medical and Dental Council of Nigeria, the head of Department of Internal Audit, Alhaji Bello Shinkafi. Also the head of Legal Units, Hajia Rabi El Usman. Permit me to also welcome from the Ahmadu Bello University, the Dean of Dentistry and a Professor of Maxillofacial Surgery, Professor S.O. Ajike, who is here with his wife. And on that note, as they say, beside, behind, in front of, on top of, below, use any preposition, a successful man is a reliable wife. The Registrar of the Medical and Dental Council of Nigeria could weather the storm accompanying the responsibilities of having this whole building on his shoulders because the home is well taken care of. Please welcome the wife of our Registrar, Hajia Bola Sanusi. Thank you very much. And with that, we move straight to the next item on the agenda, which is the induction lecture. This lecture, I must say, you're privileged to share a snippet of what I enjoyed as a student of the University of Ibadan when he taught me quite a number of aspects of obstetrics and gynecology, including abortion. Distinguished ladies and gentlemen, to deliver the induction lecture for today, Professor I.F. Adewale. But to tell you more about him is the head of Department of Medical Education, Dr. Nemeka Wakama.
Eminent personalities on the high table, Mr. Chairman, may I crave your indulgence to ask the guest speaker to please stand. It gives me great pleasure, ladies and gentlemen, to introduce to you as guest speaker for today a doctor, an obstetrician, gynecologist of repute, indeed a gynecologist, a teacher, administrator, bureaucrat, and I dare say a technocrat in politics. He graduated in 1978 from the University of Ibadan, winning the Glasgow Alumbre Prize in Pediatrics. Indeed, I must add that his first love was aeronautic engineering, but thanks to his father and his guidance counselor, they insisted that he had to study medicine, and he did it so well. He carried out his postgraduate studies at Charing Cross Hospital, London, and upon completion of his fellowship, he came back and started teaching at the University of Ibadan, working at the University College Hospital, Ibadan. He rose to the rank of a professor in 1997. He had been everything there is to be as a medical teacher. Having been head of Department of Obstetrics and Gynecology, he had been dean of the faculty, he had been provost of the medical school, and he was 11th vice chancellor of the University of Ibadan. Professor Isaac Adewale is also an adjunct professor to Northwestern University, Chicago, Illinois, United States of America. He is an editorial advisor to the Nigerian Medical Journal. He is also on the editorial board of the Global Sante Journal. In 1984, among others, I'm actually abridging his citation. In 1984, he was elected president of the National Association of Resident Doctors. In that year, the gentleman standing before you led a nationwide strike against the government of the then General Muhammadu Buhari as a military head of state, which actually led to his dismissal from work. It's ironic to know that that same general, when he became a civilian president, appointed him Minister of Health. That's who. He was Secretary General of the Nigerian Medical Association as far back as 1990. He had been Assistant Secretary General of the Confederation of African Medical Associations. He is one of Nigeria's most prolific medical writers, having published over 200 scholarly articles and over 20 books. He deserves a round of applause here. In 2005, his book, Prevention of Mother-to-Child Transmission of HIV, was published by Harvard University Press. That doesn't come cheap. He has attended over 100 scientific conferences across the world, and he holds several honors, including the Fellowship of the Academy of Science, Fellowship of the Medical College of Obstetrics and Gynecology, Fellowship of the West African College of Surgeons. He is a member of the International Federation of Gynecologists and Obstetricians, Figo. He is a member of the American Society of Clinical Oncology, International Agency for Research in Cancer, International AIDS Society, International Society of Infectious Diseases, Society for Obstetrics and Gynecology in Nigeria. I can go on and on. There are several of them. Our guest speaker for today is the only professor from Nigeria that has sat on the council of the Association of Commonwealth Universities, representing 535 universities in 37 Commonwealth countries across the world. He is on the International Advisory Board of the African Cancer Institute. He's indeed a leading health advocate, especially when it comes to nationwide access to cancer screening. He is the 11th Vice Chancellor of Nigeria's premier university. He is Pro-Chancellor and Chairman of Governing Council of University of Ilesha. He sits on the board of Adeleke University. Indeed, the Emperor of Japan honored him with the Order of the Rising Star of Japan. At a time, the former administration was looking for who would pilot the health affairs. When people thought they were going to move him to education, they found a place for him in health, and he discharged himself creditably. Ladies and gentlemen, it is my honor and privilege to introduce to you and to invite to the podium Professor Isaac Folorunsho Adewale, MBBS, FWCS, FACS, FMCOG, to deliver our lecture. Thank you.
Thank you so much for trying to paint me in some beautiful colors. The chair of this occasion, my teacher and boss, we used to trouble him when he was Permanent Secretary, Federal Ministry of Health. But thank you for all you did for us, sir. I was one of the troublesome ones. And with his then minister, you find them in the office by 7 a.m. in the morning. And to me, that was punctuality. Thank you, sir, for your service to our nation. And may God continue to prosper you. The bigger boss of the chair, Mrs. Gill, thank you so much for looking after my boss. The co-chair who has decided to make himself one step lower than the boss, the emeritus chair of the Medical and Dental Council of Nigeria, Professor Abba Waziri Hassan. Nice to see you, sir. And let me specially welcome the Honorable Minister of State for Health and Social Welfare, Dr. Tunji Alausa, to the terrain, to the turf, and I say congratulations. May God guide your steps on a terrain that could be rough, but could also be smooth. I wish you all the best. The registrar, who is actually one of the celebrants for this occasion, and his wife, Dr. and Mrs. Chanusi, congratulations on a day like this. I want to especially appreciate the President of the Nigerian Medical Association, who are represented by Chair of NMEFCT, as well as the President of the Nigerian Dental Association. It's also important to recognize some eminent personalities on the other side. I want to appreciate Senator Governor, Minister Adamu Alero. He is one of the GSM. There are few of them in the country who have held the three positions, Governor, Minister, and Senator. Nice to see you, Your Excellency. I also want to appreciate the First Lady of Katsina and appreciate the Emir of Bogu Kingdom. Let me appreciate the DG of the NYC and his wife, proud parents and guardians and their families, my junior colleagues to be inducted anytime from now, members of the press, distinguished ladies and gentlemen, it is with joy and a great sense of responsibility. I have the lecture in print for you, so you can as well go home and read it. Don't try to read the lecture today. Read it and read it after today. But it's there for you to keep, so that you continue to remember today and avoid the banana peels. That I address you today during your swearing-in ceremony. And I want to say congratulations, join others in saying a big congratulations to you on a day like this. I think my greatest qualification is my being a member of this noble profession, as stated by the Honorable Minister of State for Health and Social Welfare. And I can still remember vividly, please move the slide on. Yes, leave it here. I could still remember vividly the address delivered by the Dean of the Faculty of Medicine then, University of Ibadan, late Professor Benjamin Oshitokun. And he told us clearly that the greatest doctor is not one that can treat all ailments, but one that recognizes his or limitation. And so, my junior ones, today, know your limitation. There is no room for any heroic activity in medicine. Medicine essentially is what I will call a profession that is conservative. If you get it right, we will say, yes, well done. We've also done it in the past. If you get it wrong, Dr. Sanusi will be there to handle the matter. And I pray that you will never get into trouble with Dr. Sanusi. Next slide. Much more importantly, my junior colleagues, the health of your patient is very critical. Resolution 18 of the 55th World Health Assembly stated clearly that the health of a patient is paramount, and therefore it is important that we should not worsen their condition. There is a local proverb in Yoruba land that if you cannot make me better, please leave me alone. So as doctors, do not worsen the condition of your patients. And it's also important, go back. Do no harm is a key component of ethical principle. You must not harm anybody. Next slide. There's also the interesting part. Why do we call the client that we are treating patient? The word patient refers to an adjective and a noun. The noun refers to a person receiving or registered to receive medical treatment. The adjective refers to forbearing, not complaining, accept or tolerate delays, problems or suffering without becoming annoyed or anxious. And that is one of the pitfalls. Ordinarily, we expect that that person will be patient, but they are never patient. There is no way that the person in pain will be forbearing and will tolerate delay. So please recognize that the use of the word patient has posed a problem to us. You cannot afford to be patient without patient. And that's why I said patient versus patient. The patient is never patient. Next slide. And please note that you must be punctual and avoid the unfavorable healthcare provider attitude that turns away our patients and makes them lose confidence in the physician. Confidence is very important. Many of them, they see us as gods, little gods, and we must not fail them. When you leave this all today as a member of our profession, you must not fail that person, the patient. And I pray you will never fail them. Again, you are a role model and a team leader and should care for every team member. That team comprises the doctor, the physiotherapist, the pharmacist, the nurse, the midwife, quite an array of people. And one of the reasons why we have inter and intra-professional disharmony is that we doctors look after ourselves alone. We forget them. Yet we cannot do the job alone. So please, when you get to the top and at any point along the ladder, look after other members of the team. And you should appreciate that leadership is earned and not demanded. Never tell anybody I'm the leader. When a man wakes up in the morning and tells the wife, I'm your husband, something is wrong. That man actually has ceased being a husband a long time ago. So don't wake up and say, I'm the leader. People should wake up and say, that is our leader. And again, respect also begets respect. Some of the procedures I've learned in Obsangani, I learned them from midwives. I learned to do vaginal examination from a midwife. So never be scared to learn from them. Because you're a doctor does not really make you a super specialist, a superhuman being who cannot learn from another person. So you can learn from even the nurse or the midwife. And many of them have picked the experience over the years that will not even find in your textbook. So be patient, and your education is to better the society. And you must contribute to the growth and development of your community and your society. And I pray you will succeed in this endeavor. Next slide. Again, one of the challenges of booby traps, remember the definition of the word patient, which I said. That person is registered to receive treatment. So in other words, your patient must be registered. Documentation is key in medicine. Let it not be said that you treated someone with no record. You did not even know the name. Even in emergency situations, somebody else can be doing the registration while you are resuscitating. But do not attend to anybody and at the end of the exercise, there is no record. You do not know the name. And that will be disastrous. And then you must document every encounter with the patient. There is no problem with too much details. You will soon learn that the more the detail, the better. And no one gets into trouble by having too much of detail. You can only get into trouble when there is too little of details. Next slide. And I said, peace of mind is not about fat bank accounts. It's about contentment. Let it not be hard that you measure your professional success or competence by the number of cars you buy or number of mansions you build. Let it be that you are contented, helping people, ameliorating suffering, healing the ill and the sick and the injured. Next slide. And I said, it's a privileged position. We are highly privileged. And as I said earlier on, we are little gods. And only God knows how much secret we keep. But that secret, evil to say of you. I wish you luck, and I will continue to say I wish you luck.